Hello everyone. Today we are going to discuss about rubella, or it is otherwise known as German measles. I'm Mrs. Jansi, clinical instructor working at Triple M College of Nursing. So the objectives of today's class is at the end of listening to the session, the listener will be able to define rubella, mention the causes, brief the mode of transmission, and list down the symptoms and enumerate its prevention. Introduction. Rubella is otherwise known as German measles, is a viral illness that causes skin rash and joint pain. A rubella infection is mild for most people, but can cause death or birth defects in an unborn baby. The rubella vaccine is available in combined vaccinations that also contain vaccines against other serious and potentially fatal disease. Definition. Rubella is also called as German measles or 3-day measles, is a contagious viral infection best known by its distinctive red rash. Aside from the rash, people with German measles usually have a fever and swollen lymph nodes. Facts about rubella. Rubella is a contagious, generally mild viral infection that occurs most often in children and young adults. Rubella infection in pregnant women may cause fetal death or congenital defects known as congenital rubella syndrome, that is CRS. Worldwide, over 1 lakh babies are born with CRS every year. There is no specific treatment for rubella, but the disease is preventable by vaccination. What are the causes? The causative agent is Toga-virus. So the rubella is caused by the RNA virus of the Toga-virus family or the family Togaviridae or the ruby-virus people. So typically children in unvaccinated populations and typically adolescents and adults in well-immunized populations are affected. It also occurs between 14 to 17 days and up to 21 days. People infected with rubella are infectious for approximately 1 week before and for at least 4 days after the onset of the rash. What is the mode of transmission? It is either by direct or droplet contact with an infected person's respiratory secretions from 1 week prior to onset of a rash to 2 weeks after disappearance of the rash. Transplacental transmission to a fetus by a mother with an active infection. While she's pregnant, she can pass it to her developing baby and cause serious harm. Rubella usually occurs in winter and spring and spreads very easily. So the symptoms include mild fever, headache, runny nose, sore eyes, skin rash, swollen lymph nodes, and joint pain. The complications include rubella is a mild illness compared to measles, and most people recover within about 3 days. Possible complications of rubella include arthralgia, that is lingering joint pain that may take a month or more to get better, otitis media, inflammation of the middle ear, encephalitis, that is inflammation of the brain, which can be fatal in some cases. So these are the mainly observed complications. How could you prevent rubella? Rubella is most commonly prevented by rubella vaccine. The widespread use of the vaccine prevents outbreaks and the occurrence of the birth defects due to CRS, that is congenital. The vaccine is typically given to the children between 12 and 15 months as a part of their measles, mumps, rubella shot, that is MMR. A second dose of vaccine is given at 4 to 6 years of age. The vaccine provides lifelong protection against the disease. So the vaccine is very safe and only occasionally has complaints of fever, lymphadenopathy, arthralgia, and pain at the injection site. So this is how you can prevent, mainly by giving vaccination. So about MMR vaccine, this is a mixture of 3 live attenuated viruses that is administered via injection for immunization against measles, mumps, and rubella virus strain. that is RA 23/7. So it is generally administered to children around the age of 1 year with the second dose before starting to school. So the second dose is not a booster. It is a dose to produce immunity in the smaller number of persons who fail to develop measles immunity after the first dose. The vaccine was licensed in 1963 and the second dose was introduced in the mid of 1990s. It is widely used MMR vaccine. So the contraindications of immunodeficiency disorder, history of anaphylaxis to neomycin and pregnancy. Side effects also includes arthritis, arthralgia, rash, adenopathy or fever because of vaccine. So that is about MMR vaccine. So these are some of the references. Hope you understood the topic. Thank you.